Hi, my name is Karen Moore McIntyre, and this presentation is on how I would present different aspects of a fitness prescription to a client. The first aspect I'm going to discuss is SMART goals, how I present SMART goals to a client. So for me, SMART goals are built with the client. It's not something I would assign to a client. SMART goal is how we take a large, perhaps unwieldy goal or ambition of the clients and break it down into manageable chunks. SMART represents specific, measurable, attainable, relevant, and time. So what we would do is, after the initial consultation, discussing the goals of the client, such as weight loss, then I would help my client, in this instance, the case study client, doesn't have great nutritional habits. She only eats one meal a day and she eats out 3 times a week. So I would help her learn about the Canada Food Guide, portion control, caloric intake, nutritional intake, and just give her the general guidelines for somebody of her shape and size of what she needs to do in order to create what's called a caloric deficit, and that is how we lose weight. So I would like to have her weight loss be a byproduct of her improved nutritional goals and values, because long-term healthier eating is what's going to help her increase her overall fitness. So I would make it specific that her specific goal to be following the Canadian Food Guide for both calories and nutrition. Measurable, yes, I would suggest her use my FitnessPal app. It's very easy to use and it helps you keep track of your nutritional intake and caloric intake during the day. Attainable, yes, the Canadian Food Guides, designed for ease of use. Relevant, yes, that is, her goal is to lose weight. The SMART goal that I will help create with her will help her reach her goal, and that's relevant. And time, I would say that we would probably build it so that she would lose between 1 to 2 pounds a week, creating her correct amount of calories that she's consuming and adding on the calories she's expending through her increased fitness activity. So the SMART goal is very specific to her weight loss, which we're going to achieve by increasing the nutritional value and managing her portion and calorie intake. So that would be an example of a SMART goal for weight loss. So that's how I present it to her. I would say take the big overwhelming goal of weight loss, break it down to small manageable chunks so she would know specifically what she was supposed to do every day, and just help her see that the small sustainable changes will help her reach her long-term goal of weight loss. So that's how I present SMART goals, tools for people to use, and you can really break down any goal into a SMART goal. How would I present her risk of chronic heart disease? So how would I present the risk of chronic heart disease to a 28-year-old single mother of 2 who is at high risk? I would be factual. I would also create a rapport between the two of us before I presented this information. So I would make sure that she felt comfortable and confident, that she felt empowered, and that she was ready to take the steps. She's come to me as somebody who wants to get in better shape. She wants to improve her cardiovascular fitness. She wants to lose weight. So I would present her chronic heart disease high risk level as very matter of fact. I'd walk her through the chart, show her her numbers, explain to her what they mean. I wouldn't diagnose her. I'm not a doctor, and that's outside of my scope of practice. I would explain to her that because of her high risk profile, I need her to go to her doctor and get a PLAR Med-X and a physician's clearance form. And this is not in any way to prevent her from working out with me. I just need to be certain that she's aware of her heart health. And if because she has a family history of heart disease, I think it's important for her, empowering for her, to know where she is, what she can do to improve her heart health profile, and just to elevate her awareness of how her diet and lifestyle is increasing her risk level and what she can do about it, and that she is on the right path and already accomplished probably the biggest challenge, and that's quitting smoking, which she had done a few years beforehand. So that is how I would present it. I would give her the facts, give her how the facts are relevant, but I would also let her know that, empower her with the facts and let her use the information as something to motivate her to move further forward with her health. How would I present the results of the treadmill test? Again, I wouldn't lead with this information, but I would be very factual. Once we had designed a plan for how she was going to move forward, let her know about her high risk for chronic heart disease, I would talk to her about her treadmill test. I would explain that her blood pressure, resting blood pressure, was stage 1 hypertension. Again, something to have her doctor confirm, because I wasn't there for the test, so I can't confirm the results. Also, I can't diagnose her with hypertension. I would just let her know that that's what the numbers are indicate. Her blood pressure during the test was also inconsistent. Her systolic blood pressure rose steadily during the test, but her diastolic blood pressure was lower than resting rate when she started, and only elevated to resting rate during the test. So that's inconsistent with her heart rate and her rate of perceived exertion, which rose steadily through the test, which is what you would expect to see. There's different reasons for her diastolic blood pressure to be low. Could be vasodilation, could be underlying heart disease, could be improper use of the blood pressure cuff, could be medication. I wasn't there. I didn't perform the test. So I see that the results are inconsistent with my expectations, but again, I'm not a doctor. I wouldn't diagnose that. I would let her know that that is something she should probably discuss with her doctor when she sees them to get the forms filled out. I would go forward with the assumption of hypertension in the physical prescription, and with heightened awareness of her high risk of CHD. So that's the factors I would take into consideration for the fitness prescription. So lifestyle modification. How do I present lifestyle modification? Well, the good news is, if somebody's come to a personal trainer, they want lifestyle modification. They're looking for me to help them reach their goals. So I would take all of the information from the fantastic checklist, the PSBQ, our goal setting, our history, medical history, lifestyle choices, and take all of that together. And the SMART goals are sort of one of the tools I would use for lifestyle modification. The other thing is to suggest to a single mom who works shift work with 2 young kids at a stressful job, I don't want to overwhelm her. The lifestyle modifications need to be simple, straightforward, relevant. They need to be things she can manage. The food intake, nutritional intake, is something she has set as she wants to lose weight. So the lifestyle modification there, we have a SMART goal in place for it. She's going to need support and encouragement to attain that, but I think that that is doable. Another lifestyle modification I would probably look at is just to ensure she's getting enough sleep. Working single parents with shift work, that can't be easy, and there have been studies that have linked weight gain with lack of sleep, so I'd probably want to speak to her about that. Managing her stress level, that's a huge aspect of her life. I'm built in the flexibility program as part of her 12-week program and her fitness prescription in order to help her with some of her tension stress she has with her headaches and her tension in the back of her neck and the glass of wine she has every night. And so just trying to build in the modification that perhaps she needs to be stretching and relaxing rather than looking for some crutches that she seems to be using. Yeah, so the key to success for lifestyle modification would be small, simple, sustainable, and just progressive. Just so she would start with something she could achieve readily and easily, and then as she became more ambitious with her fitness goals, we would build in more complex modifications. So, hi. So how would I explain progressive training to a client? The progressive training principles I follow are the FIT BP principles. So it's frequency, intensity, time, type, volume, and progression. So those are sort of the basic principles I use when I'm following, when I'm building a fitness prescription. So the program design I've designed for this busy, stressed out mom is quite simple. I wanted to keep it straightforward. I wanted to make her feel capable, and I wanted to progressively add the intensity, the volume, the frequency, and the time she spends doing it. So I was definitely following the FIT program with it. I've got 3 different elements that I would be adding. It's the aerobic, which is the walking program, flexibility, and I wanted to use the flexibility program to manage her stress as well. So the flexibility would be every day. It would be a stretching program that she did either after her walking program, her resistance training program, or she did at the end of the day when she normally has a glass of wine, just to add some stretching. This would hopefully help her deal with, she said she had some headaches and pain at the back of the neck some days. And the flexibility program is in order to help her feel a little bit more relaxed, as well as hopefully prevent any tensions or imbalances she might have in her body. So the aerobic program starts out with 15-minute sessions. 15-minute sessions 4 times a week, and it builds over the course of 12 weeks to 6 52-minute walking sessions, which is a total of 312 minutes a week. So it starts out very manageable, and the progression is slow and steady, where we increase the time, the duration, we increase the volume, we increase the frequency, but it's done in a very gradual way because of her hypertension. So everything's done in sort of a long, slow, progressive path. All right, so the way I would walk her through her program is I would show her this little chart just to give her a sense that every day she'll be doing something for herself. To start, there'll be twice a week where it's just flexibility program, so that's something she could do almost anywhere, and really doesn't require a lot of time or effort on her part. It's just to increase her daily physical activity, which is really needs to be increased. Her aerobic program, it's 15 minutes of walking for the first week, and then it's 18 minutes, and then it's 20 minutes. So it's just a nice, slow, easy progression for her. It's all charted out, so it's simple to follow. She's going to have her time, so she'll know how far out she leaves from the house and when to turn around and come back. It's a little longer as she goes along, but nothing extreme and nothing with too much intensity to start out with. Her resistance program is only twice a week to start, and I'm going to have her do a Dynaband program, so she can do that at home. She can do that late at night if she needs to with her shift work. I want to be mindful that she might be working out when the kids are sleeping, so I want to give her a program that could be quiet and also infinitely portable. So, and then once a week I would have her meet with me. We would do a check-in, see if she's meeting her walking goals, see if she's managing her flexibility program, any questions she might have about it, and also to reset. Life is going to get in the way for Sarah, and she needs to know that that's going to happen, and that's okay. It's not a pass or fail. This is change, and change can take time. And I just want to set her up to feel like she can succeed. I'm here to support her, and any modifications that have to happen to the program, if she finds it too easy, too hard, too busy, whatever it is, I need to be available to her to modify it and to help her along. For the resistance training, that progresses slowly but steadily. Because of her stage 1 hypertension, I start it very light, where she has 1 set with 8 reps. That'll eventually build up over the course of the month to 2 sets with 10 reps. We keep the weight fairly steady at 60%, just because I don't want to add a lot of complications at this point in time. So we're changing, just going very slowly. So reflecting on my practice, generally I like working with clients who are deconditioned and help them radically increase their health by bringing them into a conditioned state, whether that be through weight loss, increasing their cardiovascular fitness, increasing their strength or flexibility. I really like helping people who are perhaps middle-aged, and just to really increase the functionality of their day-to-day life and their ability. I am finishing up my corrective exercise specialist certification, so I do really like using corrective exercises, and you know, and enable people to address perhaps imbalances, old injuries that have created imbalances in their body movement, stretch what needs to be stretched, strengthen what needs to be strengthened, and just help them gain more functionality in their day-to-day life. I work in large groups and small groups and individuals. I like them all. I don't have a strong preference between individual and groups. I'm happy to train both. Obviously, when you work with an individual, you can tailor the exercise prescription specifically for them and have to be a little bit more generic the larger the group gets. Biggest area would be working within sport performance. I enjoy working with athletes, and I like tailoring my own programs to be a bit more challenging. And with sports-oriented goals, I like to train for fun runs and challenge myself with a competition. I don't tend to have athletes as clients. It's probably a reflection of what I like. I like to take people who are deconditioned and bring them to conditioned state. It also is, I work in community gyms, and athletes tend to be training in sports specialized areas or with coaches. So it just tends to be out of all of my strengths, that would be a weakness that I would identify. So thank you for listening to my presentation.